by Beacon Health System.
The month of December has brought us bitter cold and snow, and local doctors say that this is also a time of year where we typically see more respiratory illnesses. In this month's Eye on Health, WSBT 22 anchor John Paul learned that the weather changes and more gatherings. It is important that you and your family know how to stay healthy during the holidays.
For many of us, it's the busiest time of year, but holiday pressures and changing weather, not the only things that could slow you down.
RSV protection in the past years.
Doctors from Beacon Medical Group Main Street have already noticed more respiratory illnesses than usual, particularly with children.
RSV, which is respiratory syncytial virus, has definitely started in the area.
RSV is a virus that can lead to bronchiolitis, which can cause wheezing, high-pitched coughing, and breathing difficulties in infants and toddlers. And doctors tell me that in recent months, one group stands out for pneumonia cases.
For our older kids, the school age, preteens, teens, we're actually having a lot of pneumonia this season.
Really?
Yes, much more so than most years.
With December's cold and snow, more holiday parties, celebrations, and family gatherings, doctors expect to see a surge in cold, flu, and COVID-19 as well.
We believe it's going to be the cold weather that drives people inside to share more germs that drives a lot of that spread.
There are 5 things that you can do right now to make sure that you stay happy and healthy during the holidays and reduce your risk of getting sick. Start by making sure that your family is up to date on all vaccines.
And that's a great way to prevent spread of things, reduce your own risk of getting severe illness, but especially thinking about the more vulnerable folks in our family, our older folks, our grandparents, people over 65.
If you're not feeling well, wear a mask to reduce the spread of germs.
It's annoying, I get it. Everyone wants to see your beautiful face, but you know, if you keep those germs to yourself, that's one great way to do it.
Plan ahead. Know your doctor's office holiday schedule. Know where you can find an after-hours urgent care if your doctor is not available. Telehealth can also help for non-emergencies. For more serious issues, visit the closest ER. Limit exposure to more vulnerable groups like newborns, the elderly, pregnant women, and people with chronic health conditions. And don't discount the benefits of good hygiene. Frequent hand washing, covering your mouth and coughing at a sleeve instead of your hands.
And just taking those precautions can go a long way.
While we hear a lot about respiratory illnesses this time of year, I learned it's not always easy for parents to tell the difference between RSV, pneumonia, COVID, and the flu because symptoms like fever, cough, congestion, and sore throat are so similar to a cold. There are telltale signs that you should not ignore. See a doctor immediately for a prolonged fever over 100.4 degrees and difficulty breathing.
Those would be things to look for. If your child's struggling to breathe or fast breathing, maybe something's going on in their chest.
Pay attention to your symptoms. How many days have you been sick? How severe are your symptoms? Are things getting worse? And use that to kind of guide, do I need to call my doctor and see what's going on? Or, you know, is this something that's getting better and I think I can ride it out at home?
I'm John Paul, WSBT 22 News.